ça moi mais il y a aussi Lupus Awareness Month. What is lupus? Qu'est-ce que ça veut dire lupus? Quoi qui cause lupus? Est-ce qu'il y a un nouveau mot pour nous ici à CCL? Mais pas du tout. Peut-être pour certains nous, oui. Mais aujourd'hui, dans Topik Conversation, mon petit pour mes autres pour dire nous pour adresser sa situation aujourd'hui. Bien voilà, quand nous réussi, gagner Dr Mahmoud qui nous a aujourd'hui, que nous pour adresser sa situation. Nous bien dit, il appelle lupus, qui est capable de dire, c'est qui est auto-immune disease, qui est capable d'affecter ou organe, mais seulement aujourd'hui. Nous parlons plus profond. What is lupus? Bien sûr, à cause de certains patients lupus ici, Cécile. Et aujourd'hui, mon réaccueil Dr Mahmoud qui rejoint moi. It's been what, after 2 years?
2 years, yeah.
Good morning.
Good morning, Carol.
How are you?
I'm fine, thank you.
Everything okay?
Yeah, all good.
All good.
Yeah.
Still down there at Hermitage?
Yes.
Still down there, il est même là, Hermitage. Il saute un petit coup comme nous, en l'air, Hermitage pour Hermitage. Un petit coup. Il sautait. Il est arrivé après des ans qui m'ont réaccueilli ici dans le studio. Bonjour Cécile. Lupus, Dr Mahmoud. L-U-P-U-S. Only 5 words, but it's big story.
Yes. Yeah, actually it's a really big story, and it's a lifelong story, if you can say.
Yes.
First, we need to, if it is like, as you mentioned, it's a Lupus Awareness Month, so we have to explain exactly what is lupus, and so that the public and also the patient who have lupus should be aware and understand exactly what problem they have, and what is the treatment options, and what kind of lifestyle they have to adopt. So as you mentioned in the beginning, it's a kind of autoimmune disease.
Yes.
So what is autoimmune disease? In autoimmune diseases, it's a group of diseases it's caused by self-immunity. If you can see in the short slide here, this is called autoimmunity.
Okay.
The word autoimmune, auto means self-immunity, is an immune system. Our body in general have the ability to produce antibodies, which is protein in the blood, to protect our bodies against harmful organisms like bacteria, like viruses, or any pathogens. But in some certain patients who have some certain genetic predispositions, this antibodies that is produced, which is supposed to protect our bodies, mistakenly affect our bodies or attack our body organs. Yeah. Like if you can see in this slide,
Yes.
if you see the boxes in colors on
Genetics.
top of, yes, genetic predisposition, environmental, hormonal. Some of those causes are already confirmed, and some of them are still like hypothesis or theoretical. But genetic predisposition is a must. You have to have the genes that it predispose to this autoimmune disease in your blood. If you have those factors, your body will produce some antibodies that attacks your own organs or body tissues. Most of bodies in lupus case specifically, almost every body organ or tissue can be affected. Not in every patient all body organs will be affected, but it have the potential to affect every body organs. And mainly the most common affected are the bones and the skins.
Hormone?
Sorry?
Hormone as well?
No, hormones is not affected by lupus, but the glands that produce the hormones can be affected or can have another autoimmune disease. If you have a lupus, you might have other autoimmune disease that affect your glands that produce the hormones. But as we said, the bones and skins are the most common affected organs, body organs, but also there are vital organs that is not commonly affected or most commonly affected like bones, but it's more important to save, like the kidney, the brain, the lungs, and the heart. There we call them the vital organs, because if any affection to those vital organs, it can cause a serious health issue. Of course, affecting the bones and the skins is a serious, but it's morely painful or some little bit discomfortable. But the vital organs can affect, like threaten the lives of the patient. So this is the nature of systemic lupus. It's a systemic disease caused by autoantibodies in your blood that affect or attack your body organs or body tissues, and it causes chronic inflammation. This inflammation, it can flare up and down, like on times. Some patients have a frequent flares, some patients have infrequent flare, and some patients have mild form of the disease which is limited to the bones and skin only, that is flare on infrequent or maybe yearly occasions.
But the inflammation, can it inflame all parts in our body?
Yes, in some patient, but not every patient will have inflammation in all body parts. But in some patient, like a small fraction of patient, they will have inflammation in all body parts. If you can show any slide, the second slide, we
the
can see.
second slide.
Yeah, please.
Yes, we will go to the second
It
slide.
will be more informative. Yeah.
Nous sa
So,
deuxième slide,
yes,
voilà.
this
Pour
is
nous garder plus.
yes, the slide is depicting the body organs that can be affected. If you can see the skin, the inflammation here. This is a very typical or characteristic skin inflammation related to lupus. We call it like butterfly rash in the face. If you see the face here on the cheeks, you see a red or pink, yes, rash looks exactly like a butterfly. So this is very characteristic or related to lupus. Also, the heart can be affected, the kidneys. Most important, the lung. We call lupus nephritis. Nephritis, inflammation of the kidney. The arthritis means inflammation of the joint of bone. Raynaud's phenomenon. Raynaud's phenomenon. This is a phenomenon which your digits or fingers turns painful and blue.
Ah.
Yeah. Not every patient will have all those organs affected, but any organ of those can be affected in lupus.
Pour qui de la cour, voilà, nous pouvons mettre bon portrait en même temps, nous pouvons donner plus l'explication sur ça, nous appelons butterfly, par le docteur dit, là où figure, ou voit ça redness, ça paraît, il y a symptômes, ça, il y a symptômes systemic lupus, a symptôme of systemic lupus. When it's like that, doctor, do they have to report?
In fact, this is a good question because we don't want people to panic.
Yes.
Because if I asked you or me or anyone in the world, do you have a joint pain? Anyone will say yes, I have some joint pain. But yeah, you don't need to panic for every single symptom of this. You need to have a group of symptoms for a long time, which is associated with fever. First of all, you have to report to your doctor. You cannot diagnose or you cannot suspect lupus yourself unless you see some certain characteristic manifestation. If you saw, like specifically, if you saw this red butterfly rash on your cheeks, this can be lupus. You should. It's not a must, but you have to raise your attention that it might be lupus, that you have lupus, especially if it is associated with joint pain or bone pain and fever for a long time. Not for 1 day or 2 days, of course. For a long time, you have fever, you have joint pain, weakness. Yeah, this is a slide showing the symptoms, group of symptoms that might raise your attention that you might have lupus. Like you see, almost all systemic inflammation, almost every organ can be affected, like the fever, the chronic bone or joint pains.
Headaches.
Yeah, headaches, fatigue, mouth ulcers or mouth rash, hair falling, shortness of breath. Skin rashes is very, very important. Skin rash, especially when you're exposed to direct sunlight, because this lupus rash is sensitive to ultraviolet rays. So if you got having rash, red rash, and not only sweating, but just red rash like red spots or butterfly rash on your face when you get exposed to sun. So again, you have to see your doctor because he's the one who's able to run the test and compile the information together to get you a proper diagnosis and which is a significant problem or it's just some rash or some kind of allergy.
Normal rash.
Yeah, because again, the lupus symptoms, as you see, it's a systemic, so it affects many things, so it can get confused with or mimic or be similar to other diseases. And the differentiation between all those diseases are sometimes can be challenging and sometimes need like thorough investigations and in-depth analysis.
Fatigue?
Fatigue, yes, fatigue is very important because one of the tissues or one of the body organs that is affected here is the blood cells. Again, the antibodies can affect your blood cells, so it can give you anemia. So anemia can give you fatigue, of course, if you have anemia. So it gives you shortness of breath. You cannot do your daily activity. You feel tired all the time. But again, not everyone who feels tired, he has lupus. This is only one of the symptoms that we can raise your attention if you have all those symptoms together.
C'est celle, aujourd'hui, bon matin, nous pouvons mettre si avec symptômes, bien si, qui est capable d'infarcter lupus, soit waouh, peut faire face, bien si, expérience, ben symptômes pareil. Nous pas dit, lupus, docteur dit pas dit, faudrait absolument, bien si, qui est capable consulter un docteur, bien si, pour capable identifier si ça est lupus. Any doctor can identify lupus?
Yeah, any doctor is not is not any doctor can identify, but because lupus itself as a process, it need a long-term follow-up. But any doctor, yes, he has the knowledge of lupus. He studied lupus in the medical school. He saw some patient of lupus, so he can, once the doctor, especially the primary doctor, or we call it your family doctor or primary healthcare doctor, is able to identify the symptoms of lupus and the basic criteria. He can start running the test, and if his suspicion is high, he usually refer the patient to a specialist or the specialized care in the hospital. But of course, yeah, any doctor can identify the main symptoms of the lupus, and he can request the primary tests for you, the blood tests, the scans that is required, and if there is a high suspicion or even it's diagnosed at the level, so he refer him to the specialist to continue the follow-up and the specialized care he require.
A patient with lupus, doctor, does it mean that they have to change their lifestyle?
Yeah, definitely, yes. They have to adapt a healthy lifestyle, because as we see, we have two forms of lupus, as we said. There is a mild form that affect your bones and skins only, and there is a form of severe disease that affect the vital organs, the kidney, the liver, the lungs, and the heart. So the main goal of treatment of lupus is to keep your lupus limited as long as you can to the mild form. Some patients, they live their like all their life with a mild form without any affection to their vital organs. So you need to delay the complications. You need to stop the progress of the disease. So this will happen only if you commit or adhere strictly to your medication and to a healthy lifestyle.
Once you get lupus, can it be cured?
Complete cure is not common, complete cure, but there are some patients who have, I'm telling you, a mild form of the disease that is flare up on very infrequent occasions, like it's controlled by simple medication, not aggressive medications, and the flare up can come and goes like on maybe 1 year, 2 years, just one flare up. And their disease is limited to a mild form.
Doctor, we know that we have a few cases of lupus here in Seychelles. What can you say? Is it alarming or significant?
No, it's significant. It's not alarming because we don't see like a sharp rise like on the cases, but it's significant disease because it's a major. This is one of the diseases that once you call it chronic. Chronic means it's long-term treatment. As we say, in many patients, it's a lifelong journey, and in some cases it can affect vital organs. So it's a very significant health issue that it requires more attention, more care, more careful treatment for and management for such group of patients, and more education as we're doing now.
It is severe, doctor? We can consent. Is it death-threatening?
Death-threatening. Once it's affecting a vital organ, so it can be severe if not treated properly. Because the good thing here is like till recently, like in the last maybe 1 decade ago, the lupus was almostly a fatal disease, like the severe form of the disease, of course. But in the last 10 years, there was a lot of advancement of this disease treatment, and there is a lot of new medications and a lot of understanding of the nature of the disease because of the advancement of the technology and the laboratory tests that we do. So we understand the disease much better than 10 years ago, and there is a lot of new medication that it can control this disease. So the treatment success rates are much higher now, and the death rate has declined a lot from this disease. Like we are able to treat, and we deal with very significant and complex cases of lupus now, and we can keep those patients functioning and live a healthy life or near healthy life as long as possible. So The death rate is much less now, and it's you can see it in like in few patients. Like also here in Seychelles, we have a lot of and good experience in treating patients with lupus. We have, as you said, we have a number of patients. We treat them with high success rate. We don't see like annually deaths of lupus recently. Like maybe like in the last 5 years, we haven't seen maybe 1 or 2 patients, something like this. And it was aggressive disease from the beginning, and it was yeah. So we don't say it's not fatal, but there is a lot of advancement, and the death rate has reduced very much from the disease due to the advancement of the treatment. Yes.
The treatment, is it a long-time process?
Yes, it is.
It
It's
is?
lifelong.
Lifelong?
Yes, it's lifelong treatments. But again, it's a good thing because it's a chronic disease you have to deal with. So if like diabetes, like hypertension, like asthma. So if you have a condition that will last for your life, and it's that before 10 years it was fatal, and now you can live with it with just 1 or 2 pills every day, this is a good achievement, and it's good, like it's acceptable.
But you have to take the pills every day.
Yeah, you know, it's not a must, not in every patient. Again, because there are mild form and there's severe form. Severe form, yes, you have to take your medications every day. Mild form, you have to take the medication in some patient every day until the disease is in remission or stable, and then you can take the medication only when required. Because lupus have a broad diversity of symptoms and have variation between one patient and other patient. We don't treat all patients the same for lupus because these are standard treatment guidelines, of course. But we categorize patient to mild form, severe form. Even mild form, there is frequent flares and there is infrequent flares. The severe form also, which organ is affected. So there is a lot of variation.
Not all patients are the same.
Are the same, exactly, yeah. So some patients, they need to take the medication every day. Some patients, they need to take it every day until remission, and then they can take it once their condition is stabilized. They take the medication when necessary only.
We have questions from our viewers this morning. I bet it's a patient. They say, good morning. Good morning. I'm dealing with the autoimmune situation since my last vaccine. Is there a cure or a remedy? Vaccine?
Yeah, vaccination. Usually people ask for this question, yeah. Because not only vaccine, any medications that you can get, any medication have side effects. One of the side effects of any medications is you can flare up your immunity, because vaccination, the main mechanism of action of vaccine is booster your immunity or increase your immunity towards certain disease. So the same as we mentioned, autoimmunity, that your body immune system in attempt to defend your body, sometimes by mistake it affects your body organs. So if you receive a vaccination and you have a response with high immunity, this high immunity, it might by mistake again affect your body. But this is a very small fraction of patients, because because any vaccination before it's being marketed has to go through a lot of tests, analysis, and experiments on animals first, and patients and individuals. So it goes through a lot of tests and investigation before it's approved for being used in the public. So it can happen, but it's not a frequent occasion that you see that autoimmune from vaccination. But it can happen, and sometimes it's just a small autoimmunity like skin rash or allergy, and sometimes it might be more disturbing condition.
Doctor, I have this question now. Many of us are asking this question. We have noted that it affected the female more.
Yeah. Actually, this is a fact about the systemic lupus and most of autoimmune diseases. It's not known why, but most probably, as we saw in the first slide, the hormonal factor, it can cause autoimmunity or the autoimmune disease or systemic lupus. Yes, it's affected by genetic, by environmental, and by hormonal. And women are more prone to hormonal changes during
Yes.
their cycle, pregnancy, lactation. This all like physiological conditions are already related to, are prone to hormonal changes. Sometimes the estrogen is high, sometimes the progesterone is high. So this hormonal changes is affecting your body. That's why this is a hypothesis why lupus is more frequent in female than in male. But this is a fact. Yes, it's more common in
But
women.
what if a lupus patient, a female, sh- she must be very careful if she wants to get pregnant?
Yeah, definitely. This is actually the most important question today.
Yes.
Because because first of all, what you need to know about lupus and pregnancy, uh, lupus doesn't affect the fertility. Like so,
It doesn't
means
affect
it doesn't
fertility.
affect fertility. It means
It is
that
safe.
it's not. I mean, fertility means that you can get pregnant normally. Okay, so you can get pregnant. It doesn't prevent you from being pregnant. Okay, but if you're willing or planning to get pregnant, so your pregnancy has to be very well prepared and planned. You should have a good family planning if you have a lupus, systemic lupus. Why? Because pregnancy can flare lupus, and lupus can affect the pregnancy. Both of them can affect each other. So before you get pregnant, you should inform your doctor, the treating doctor, physician, that you are planning to be pregnant. Why? Because before you get pregnant, at least for 6 months, you should be free of any symptoms or any inflammation. And your blood test should be normal or near normal, at least for the previous 6
You have to run a series of tests. before.
Exactly, yes, exactly. And even the medication that we give you for lupus, some of them cannot be taken if you get pregnant because it can affect your baby. So you should be symptom free, your blood test should be normal, as you said, and the medication has to be adjusted to match your pregnancy. Otherwise, if you get pregnant, you might have a problem to your baby, problem to yourself, like the lupus might be flared by pregnancy itself.
Complications?
Complication might happen, of course. It's called high risk pregnancy.
High
Yeah.
risk pregnancy. Ben, madame, la bon matin. Nous peut tous un petit peu à cause de lupus, nous remarquons pour dire affecter plus de bonnes petites filles, bonnes madame, bonnes mademoiselles, bonnes mademoiselles. Alors, nous peut tous un petit peu plus la bon matin. Si vous pouvez imaginer, si vous êtes patient lupus, si vous pouvez imaginer pour à faire aux familles, bien sûr, it's best that you go to your doctor and advise.
Yeah, ask that. Yeah, you're planning to get pregnant. So what advice he can give you, and he will give you the proper advice, the proper management, and the adjustment of your medications, and he will run all the necessary tests for you for preparation for your pregnancy.
But after 9 months, do that patient have a safer delivery to the labor room?
If the lupus was, in most of cases that we deal with when they get pregnant, if the lupus remain very well controlled during pregnancy, you will have a normal delivery and a healthy baby.
Normal
But
delivery.
yes, it can go to normal delivery if no complication happen during pregnancy. Yes, it can have a normal delivery, and it's advised to have a normal delivery.
What about the baby?
The baby will be fine as long as you adhere very well to your medications, to the doctor instructions, and your lupus remains unflared during the whole pregnancy. The baby will be normal and healthy. Otherwise, if you don't plan, the problem is if you don't plan for your pregnancy, like for example, you don't stop certain medications or change it to another one that is good during pregnancy, or if you get pregnant while you have a flare-up of the disease, this inflammatory process, it might cross the placenta and affect your baby. That's why we have to prepare you very well for the pregnancy.
There's a chance that it can happen?
Yeah. Yes, actually, in fact, lupus is associated with another autoimmune condition called antiphospholipid syndrome. This is syndrome, there is very high association between this and lupus. And this syndrome, it causes blood clotting in the placenta, and it can cause abortion or stillbirth. So this have to be identified and has to be dealt with before your pregnancy.
Un petit peu compliqué pour bonne madame qui si vous êtes des patients lupus peut envisager pour faire un enfant, but it's not advisable to be pregnant when you are a lupus patient.
I don't say that because one has a
What
right
do you
to.
recommend?
I recommend, yes, plan very well for your pregnancy, and the family planning. Family planning that like you say, 2 children is enough, because pregnancy itself, even normal individuals without lupus, there is always some advertent events during the pregnancy that you don't want to go through. So family planning is a must. At least like you can have maybe 2 children, and also there will be some time between the pregnancy. Should not get pregnant successively, and once you desire to get pregnant, you have to express this to your doctor, and you have to plan before.
Voilà, un petit peu bon détail, bien sûr, bon conseil, si vous pouvez envisager pour faire des enfants, bien sûr, un petit peu complexe, oui, mais seulement il y en a une douzaine d'onnes aussi qui pour faire. Donc, il recommande ça. Et seulement, il pas empêche nous. Fertilité, oui, mais seulement, il y en a une bonne complication qui viennent avec. Once you are a lupus patient, how often should you go for your checkups?
Usually we see those patients 3 to 6 months.
3 to 6 months.
Yes, according to their flare-ups and disease severity. If it is just mild, and some patients they haven't experienced any flare-up, and even the medication they take it only when necessary. So this patient can be like 6 months seen, but some patients they might be seen up to 3 months. And if you have a recent flare, some patients they might need even seen sooner or earlier, like within 1 month. But the usual is 3 to 6 months should be seen in their clinic.
Some from our viewers, are we equipped with everything regarding lupus here?
Yeah, we have the knowledge, we have the logistics to diagnose this disease. We have the lab test, we have the scan test, and we have all the medication. Most of the medication are available here, but even so, if it is not available, we're capable of sourcing because some patients they require special medication that might not be available locally, but we request it and we order it, and we can get it from overseas. Yes, but the basic treatment and the basic logistic, we have it here. If anything extra is required, yes, we request it from overseas.
But it can be treated here.
Yes, it is treated here with high success rates, and even we have some achievement in this, like we have some published cases that in international, one of the largest medical journal in the world, we have published complex case that has been treated here in Seychelles with high success rate, and even like is cited as an example for treating lupus and complex cases of lupus. Exactly. So we managed to build experience and good knowledge of this disease, and we treat it with good experience and good knowledge.
Good. We have knowledge, and it can be treated. It is being treated here in Seychelles. Now, somebody is asking, because we have talked about lifestyle, definitely it will change once you've got lupus. Somebody is asking about the diet and nutrition.
Okay. Yeah, this is very important. When you have a lupus, now you understand what organs can be damaged. The most important organ that we need to save is the kidney. How we save the kidney is with good hydration. Good hydration that you have to drink every day, 2 to 3 liters of water and fluid. Yes, mainly water. Water is the soul of the kidney. Okay, you have to drink 2 to 3 liters of water every day, and this is for public, not only for lupus patient, but lupus patient specifically, because the kidney is already can be attacked by the disease itself. So you need to protect it by the good hydration. If you are overweight or obese, you have to adopt a sugar-free or fat-free diet, because again, obesity can lead to diabetes, can lead to hypertension, and those 2 conditions are very well known risk factor for kidney problem. So if you have a lupus, you have diabetes, you have hypertension, so your kidney is in a big danger.
Very complicated.
Very complicated. So yes, so your diet should be balanced towards good hydration, like plenty of fluid, diet like low fat diet, to reduce the overweight or the obesity. And also the healthy diet, what we call it, the balanced diet. Balanced diets, we know what is balanced diets. You can even read about it. It should depend on more on vegetables, fruit, and white meat more than red meat, and whole grains.
Whole grains.
Yes.
Voilà, un petit peu occupé des man l'eau, son diet avec son nutrition, un petit peu compliqué. Il y a aussi tout ça quelque chose qui vient compliqué en effet. Alors ça on nous fait bon prévention ou qui des patients lupus ou qui connaît quelque chose qui moyen ou lifestyle insensé en même temps ou nutrition aussi insensé, but for those who are not a lupus patient yet but are very curious now. What do you have for them? What do you say?
If you have a family member who have lupus, okay, so you might do some blood test, like visit the doctor. You don't have to go yourself and to do the blood test. You have to go your primary doctor and explain to him, like mostly the first degree relative, okay, like brother, father, mother with lupus. So you might just run some tests. But if not, you should not get panic. You should just adapt the healthy lifestyle, and you should just keep in mind the symptoms that we have mentioned here: the skin rash, the joint pain, the daily fever or frequent fevers, the fatigue, the hair fall. So these are the symptoms of lupus. If you notice any of those, you have to see your doctor and ask about advice that you've seen that you have like skin rash when you get exposed to sun, you have joint pain, you experience fever every night or every day. So this can be symptoms, and ask your doctor. He will give you the proper advice for this, if it is something significant or just some normal condition that can be treated easily. But for the lifestyle, before we pass this lifestyle condition, we mentioned the diet, also the exercise. Exercise is very important for lupus patient, but again, not brisk or excess,
not
like
brisk exercise.
Yes, just
not hardcore exercise.
No, not hardcore exercise, of course, because hardcore exercise will give you joint pain or or exhaustion of your joint and muscles, and you don't need this. So you need at least, again, the normal or the modest exercise. We mentioned like 30 minutes a day, 5 days a week, and you can have the weekends
30 minutes
off.
a day, 5 days a week.
Yes,
it's enough.
It's enough. Yeah, why?
No hardcores, please.
Yeah, no hardcores. Yes.
Even for 30 minutes.
Yeah, because hardcore, after all, you have already by lupus, you have a joint pain. So if you did a hardcore, you will have more joint pain. So you will stop after 1 or 2 sessions of exercise. So you just need to go like, as we mentioned, this or equivalent, like swimming, for example. Swimming is very good exercise, and it's a static or hydrostatic exercise. It strengthens your muscle very well, because in lupus there is some muscle weakness because the antibodies again attacks the muscle, so there is muscle weakness. So swimming is very good exercise for lupus patients, and walking, as we mentioned, 30 minutes a day, 5 days a week. But if you going to do exercise, it's advisable for lupus patient to be indoor exercise, or not on direct sun, because as we mentioned, the direct sun exposure, it will flare up your rash.
Or under the veranda.
On the veranda, you can get some treadmill at home, or if you want to go like an open exercise, just at the sunset time, just before the sunset time or early morning, before the sunrise. Yes, because the sunrise exposure or prolonged sunrise exposure, it might flare your rash. It give you very, very itchy rash. Yeah.
So can we say that to avoid the sun, stay away from the sun?
Yes, this is advised for lupus, but again, it's not complete. You have to get sun exposure at least once a week, because if you completely avoid the sun, you will have vitamin D deficiency, and it will worsen your bones. So at least just once a week, and it's not prolonged. It's not more than like 15 to 30 minutes sun exposure. Okay, and should not be the diet, like it's not be at noon. It should be like
noon it's oh my God.
Yeah. You don't go like to the Victoria.
Parlez, là, ils vont dire bon matin, midi, avec ça soleil, sur la pour moi du monde.
Exactly, yeah.
Especially if you are a lupus patient, you have to be very careful. Prevention is better than cure.
Exactly.
Better safe than sorry. Étant nous peut cause lupus, nous mettons série bien si bon symptômes qui bon patient lupus y expérience. Bien si sous peut ça bonne expérience ça pareil, nous pas hésiter. Juste consulter un docteur. It can be or not, mais seulement juste consulter un docteur à cause you never know. Qui est capable d'arriver, quelquefois on peut regarder, on peut dire ça, il est capable de quelque chose aussi, qui est docteur, il découvert, instead of vous croire, ou peut gagner lupus. Okay, from our viewers, hi, good day to you all, good day. Doc, what is the origin of the lupus and how widespread is it here? Thank you.
What is the origin and what?
Origin of the lupus. Of this lupus and how widespread is it here?
No, it's not an infectious disease. It's a condition that it happens, as we mentioned, the causes is genetic problem. Genetic means inherited, like you get it in your DNA, in your genes, inherited from the ancestors. So it's not spread because it's infectious. It's just like diabetes, like hypertension. It's a chronic disease that inherited in your genes, and it comes from the ancestors.
Wow.
But yes, in Seychelles we can say also, because we are a small community here, so the small community, the exchange of genes, because there is what we call it consanguinity, like the marriage of relatives, because most of people in Seychelles are relatives.
Our relatives.
Yeah.
My surname.
Exactly. Some way. So yeah, this consanguinity, it can increase the risk because you have the genes and your relative has a gene. If you get married, so of course the children will have stronger genes in your blood. But it's not infectious, because some people, when they see that the skin rash, they think this is infectious disease. No, but lupus rash is not an infectious disease.
Somebody is asking, can everybody or can anyone get lupus?
Yeah, we can't know which one unless you do a genetic mapping for the every individual. But no, of course anyone can have it. But there is some who said there is some predominance to women than men in this condition. But anyone, like even at any age, it can.
Any age?
At any age, it can start from early childhood till elderly, but most frequently it's from the 4th and 5th decades of life.
Voilà. Nous bon détail, nous c'est aujourd'hui bon matin nous parlons un petit peu poli pour fond.
It's more common in this age group. To
It's
start
more common.
to develop, like to first presentation in this age group, like 30 something till 40 something. This is the most common.
30 above.
30 above. No, 30 to 40 is the most common age group that start like the presentation. But again, it can present in children, and it can also present in more older people.
Tout le monde est capable de gagner lupus. Et ni là, pareil, nous dit, mais seulement présentation lupus, il est capable, il peut gagner voir les 30 ans en montant, bien sûr.
So usually the typical patient is a lady at her 30s or 40s of age who come with chronic fever, chronic joint pain, chronic fatigue. She usually comes for complaining of hair falls and other symptoms. This is a typical patient of lupus.
Let's stay on hair loss, doctor, because somebody is asked just to shed some light, so there'll not be any confusion about the hair loss thing, because it's one of the symptoms of lupus, hair loss. But it's also, study has said that every day you should lose some of the hair.
Yeah, for lupus?
Yes, let's shed some light on this.
Yes, you see frequent, but again, because many ladies, sometimes actually it's a natural process that to change, like all hair fall and new hair. But in lupus, the hair fall become like, you notice that it's started to be like more rapid. Or even you can see bare areas in your scalp.
Really?
Like, yes, like we call it alopecia. So it's the hair fall becomes significant that you see. It's alarming. It's not that the normal that you see every day when you shower, when you wash your hair, that you see some hair. No, you see it's becoming more frequent and more severe, that you see some areas of the scalp there is no hair
What about
at all.
bald head?
That's it. That's what's called alopecia. It's like spots, like bald spots in your scalp, or sometimes you see some areas of where there is no hair at all.
Yes.
So you have to cover it with your hair. This is alarming sign. But not everyone who has hair fall have lupus. This has to be combined
Yes.
with other symptoms.
Just to clear this confusion.
Yeah, because this this is every lady will start to get
Yes,
panic.
otherwise everybody will.
Yeah.
Toujours un point inquiète. Sinon, le temps nous va nous servir, nous commence à perdre CV, qui en effet est normal, pas pour nous perdre un peu bon CV, qui est normal, mais seulement pour nous, si ça confusion, bien si, mais seulement si on est un petit peu inquiète, ou capable de consulter un docteur.
Oui.
Le docteur dit oui. Alors, ça, pas besoin trop inquiet, mais seulement, il y a des gens qui sont inquiètes un petit peu. Alors, quand c'était un docteur, monsieur, madame, mademoiselle, nous a dit bon matin, nous type cause avec le docteur Mahmoud, bien sûr, qui nous aide encore une fois, après 2 ans, quand aujourd'hui, nous cause une maladie spécifique, lupus, vu que lupus awareness month, ça m'en met là. Alors, ça nous décidé pour causer un petit peu là, à cause simplement, nous en avons ici, bon cas, ici c'est celle, nous avons des 3 patients qui gagnent lupus, bien sûr, et ça il gagne considéré comme assez sévère, aussi désiré, si nous pouvons mal gérer, prévention, nous cause là, traitement, nous cause là, what do you do, bien sûr, et tout ça là, il y en a, it changes your lifestyle, pareil, n'importe quelle maladie chronique. It changes your lifestyle.
Yeah, this is a take-home message.
Yes.
That you have to adapt a healthy lifestyle, keep exercising, hydrating yourself well, and yeah.
Alcohol?
Of course, yeah.
We didn't say that.
No.
We didn't talk about this.
Because it's logic. You don't have to talk about
It's logic.
it. It's logic. Yes, to
It's a
stop
big
it.
no?
Yes, a big no, because because the stomach, the liver, the kidneys are affected by alcohol intake, and yes, this alcohol, yes, it's, you don't need it if you have a lupus. Yeah.
No alcohol. It's a big no pour l'alcool. Bien, c'est pareil, nous dit, it changes your lifestyle. So, l'alcool aussi, il vient mettre d'abine, and fois pour tout, stay away from the booze. Like we say, à cause, il est peu dangereux. Voilà, aujourd'hui, bon matin, bien sûr, nous type cause avec Dr. Mahmoud, bien sûr, qui nous type cause le lupus, il est très nécessaire, très important, qui nous tient à préciser aujourd'hui à cause peut-être il y a un mot qui pas trop familier avec nous, mais seulement il y en a. Pour bon qui nous bonnes patients, autres connaissent what is lupus already, mais pour vous qui pas connaissent dans la cour, pour nous qui pas connaissent, alors ça, nous connaissons aujourd'hui. Watch out for the symptoms, please. Watch out for it. Better safe than sorry. Report to the nearest clinic.
Yes.
What about the community health center?
This is what I'm talking about, the public, the primary health care. This is a community clinic. The doctor there, yeah, they are aware, they know how to deal with this condition, or like taking the proper history, doing the proper tests, and if it is proved that you have this condition, they will give you a referral to the specialist to treat you. Or even if it is not confirmed but it's still in suspicion, they will give you a referral to the specialist clinic to continue your follow-up there.
Does it take long to know that it is lupus so identified when you come to the clinic?
It's not about when you come to the clinic, because lupus, the natural history of this disease, as I'm telling you, it varies very broadly. Some people, they have only some joint pain for years before developing other symptoms, and even before the blood test become normal. So those patients, they require a long-term follow-up before we give the proper diagnosis of lupus. Some patients, they come clearly from the beginning with all symptoms, and in between there is a lot of variations. So sometimes we receive the patient, but we once we run the test and everything become normal, so we start the treatment. But some patients, we still need to see them like frequently for a few more visits before we see some change in blood tests, or their blood test comes positive for lupus. So yeah, it varies from patient to patient. But the proper follow-up will be the good practice here. It's just to see your doctor and to adhere to the instructions and the treatment he will prescribe for you. I want to say at the conclusion, there's a good and there's a great advancement of the management of this disease. There's good understanding of this disease, and the success rate of the new medication and new treatment is achieved already. So most of patients with lupus will have a good lifestyle or near normal lifestyle if they adhere properly to their medications.
Voilà, un petit peu, nous topic conversation aujourd'hui, bon matin, nous connaissons un petit peu plus profond, bien sûr, what is lupus simplement, cause il y en a ben, deux, trois patients ici, c'est celle qui gagne lupus, bien sûr, que nous adressons un petit peu plus profond avec le docteur Mahmoud. Docteur, any last word?
Yes, as I mentioned, lupus is a chronic condition, but it's a controllable condition. It can be controlled, but your lifestyle, your adherence to the medications, your follow-up for your doctor instruction is a cornerstone for your treatment. And if you achieve all those, most probably you will have a normal life and you will enjoy your life.
You can live a normal life.
Yeah.
What does the future look like?
It's much better because I told you 10 years ago, the condition we were having a lot of difficulties dealing with lupus, and even the treatment option was very limited. Now we have a lot of broad options on the shelf, to treat this condition with high success rates, and even the side effects for most of patients becoming less with the newer medications.
Voilà, aujourd'hui, bon matin, Dr. Mahmoud, qui type adresse lupus. Il n'a pas son équivalence en créole, son mot, il simplement lupus. We don't have a Creole word for it.
Yeah, no, it's lupus.
Lupus.
Actually, it's Latin. Even it's not English, it's Latin.
It's
Latin word, yeah.
It's a Latin word?
Latin word, yes.
Oh, ok. Nous n'avons pas son équivalence en créole, mais seulement pour bonne patient lupus, nous autres connaissons qui cette situation. Alors, nous, autres bonnes patients, là, bon matin, nous souhaitons et nous prions qu'ils soient capables de faire tout bonne chose bien regarding lupus, à cause c'est assez sévère, bien sûr. It's death threatening, yes, seulement. Nous autres connaissons à peu près là, déjà de sa situation, nous autres connaissons how to go about the do's and the don'ts. Dr. Mahmoud, thank you so much.
Welcome.
Merci beaucoup pour venir moi là bon matin.
My pleasure.
It's been so long. After 2 years.
Hopefully it's becoming more frequent in the
Yes.
future. Yes. We have a lot to talk about.
Yeah, we have a lot to talk, and I hope to see you again soon.
Yeah, sure. Yeah.
Have a nice day
always,
today.
Yeah, my
Yes.
pleasure.
Et c'est ça, c'est le topic conversation.